Here we are, April 21st, and really the second month of the pandemic affecting us all. Some good news in some ways that the curve seems to be flattening. The numbers of new cases coming out of New York and some of the hotspots are decreasing. They're certainly decreasing in Italy and Spain and some of the areas in Europe that were hit the hardest. Other parts of the country, the social isolating really is working to keep the numbers down. Virginia's numbers are still, fortunately, fairly small. And most of the deaths are in nursing homes where we're seeing some pretty horrible things where it's going through like a wildfire with vulnerable old people. So what we're doing is working. We're all using our hand washer, and I'm carrying it around everywhere I go and washing hands frequently, and we're using masks on a regular basis. I'm sensing a little fatigue out there because I think people are getting a little sick of this, and certainly it's had a huge effect on the economy and on our lifestyles. But we need to keep it up until it's time to go back. People's recovery, I'm hearing a lot of people using Zoom meetings or other online meetings, and people starting to really, certainly getting a lot of benefit out of that. I see most people who've got a strong recovery program where they've got a lot of support groups, a lot of meetings, a lot of having a sponsor. Their recovery's strong and everything's good. We are starting to see an uptick in people wanting to come in for detox and treatment. I think people put it off for a while, but the reality is set in that, it's time to do something. So they're coming in for detox off alcohol because it's just not working, getting drunk every night and trying to deal with all of the stress. And we're seeing people who are realizing that going out on the street and buying heroin, which of course is laced with fentanyl, and you have no idea what you're getting or who you're getting it from and what risk. So we're starting to see more people come in for detox and help, which is good. And I'm proud to say that we're still offering our services in that way to help people out and seeing good success. Where we're going to go from here is a big question. I think I can see some hope in the future. We've now got instant tests that are starting to become more available, so I can see a world where we can get instant results within a 15-minute period to know whether you are positive or not. That's going to be a huge difference. Testing is the way out of this. We've also got serology tests, which is a blood test looking at antibodies to see if you've had the infection. So I can see a world very soon where people get a blood test, and if you're positive, that means you've had the disease. It means you're protected against getting it again, pretty much, we think. We're not 100% sure, but most likely with most diseases, you're protected from both getting it again and from giving it to other people. So we might almost end up with a world very soon where people have an almost immunity card, where they can go back to work, go to work in hospitals and feel safe themselves, and that they're not going to hurt other people. And then if you combine that with instant tests, we just may be able to get on airplanes again by doing an instant test before you get on or showing your immunity card. And so we can start going back to some semblance of normal. I'm sure there's a lot of testing going out of different medications that can actually make a difference if you are positive. Certainly some of the research on interleukin-6 blockers is looking really good for people who are really sick and in hospitals. And some antiviral drugs are being tested, which I think is going to make a big difference and cut down on the mortality rate. So we're making progress. It's still going to be a while before a vaccine is out, although they're already testing. I think I saw 70 different vaccines are in testing right now, and some of them are even in phase 1 trials in humans. So I can see that could be coming a while down the road. They have to make sure they're very, very safe before you start giving them to millions and millions of people, and of course make sure they are effective. So we've got to hang in there a bit longer, hopefully not too much longer. My home country of New Zealand, their numbers of new cases, it was down to 5 yesterday, and the government is already thinking that it's time to start easing some of the restrictions in a measured fashion. The Prime Minister apparently said, well, we're out of the operating room and it's time to get into the recovery room. So we're making progress. We've got to hang in there, keep doing what has been working, and be careful, be safe, and of course, work your recovery program so that you stay strong and healthy drug-free and in recovery so that you help yourself and help everybody around you. Thanks.